Have you noticed that politicians struggle to enact the things they run on? That regardless of who wins elections, lawmakers cannot pass whatever legislation they like. They find themselves bound by what is popular, or at least their sense of it. They can only act within a narrow set of ideas, and that range is called the Overton window. And on the Overton Window podcast, we look at issues around the country and talk to the people who change what is politically possible. Now, it seems to me that people would have less options or fewer options and pay higher prices if businesses had to get permission from their competitors to enter a market. And I'd struggle to find a good justification for this regulation. Yet, this is policy in many places around the country. Some medical providers have to do this because of what are called certificate of need laws. And I'm here today with Alasdair Whitney, legislative counsel with the Institute for Justice, who is on the forefront of the fight against these laws. Alasdair, welcome.
Thanks so much for having me today. Really, I'm looking forward to our conversation.
Tell me about certificate of need laws.
Yeah, so certificate of need is basically a government-mandated permission slip to either start, modify, or expand a business in the healthcare industry. And con laws vary from state to state, but a common feature of obtaining a certificate of need in any one of the 38 states that have this requirement is that it involves incredibly complicated, expensive, and time-consuming processes. So imagine, for example, that there was a certificate of need regime in place for opening up hamburger restaurants on a certain neighborhood in a city. Imagine how crazy it would be for Burger King to have to apply for state government permission to open up a restaurant right across the street from McDonald's, and then having the state process for granting that certificate, allowing for McDonald's to intervene in that process and, of course, say, well, no, there's already a burger restaurant here. There's no need for another one. That's what we're talking about here. So with respect to the healthcare industry, which is what we're talking about today, con programs were conceived with this goal of controlling healthcare costs and increasing access to care. One of the ideas behind con was a concern that more available healthcare services and providers would lead to higher costs. Driving this concern is that doctors and medical professionals would encourage patients to consume services that they otherwise would not have chosen. So, in other words, what we're saying here is that the origin story of con was that it was originally intended to limit induced demand by artificially manufacturing scarcity of available resources and facilities and services. But in the decades since the first con laws were enacted, they have proven to do the opposite. Costs in certificate of need states are skyrocketing, and the availability of healthcare services is completely inadequate in those states. It's the worst of both worlds. This result, of course, is easily explained by basic economic principles. If you restrict the supply of a service and demand increases due to, say, population growth, which is, of course, what we've been experiencing in this country for decades, prices will invariably rise. And predictably, we have seen that states with con laws have higher healthcare costs and fewer medical services per capita. The overwhelming evidence, including the unwavering opinion of the federal government for more than 3 decades and several states around the country, has been that con laws are a public policy failure.
So listeners and viewers, I want you to notice something that Alasdair did right there, which I think is just a testament, a mark for someone who really knows this issue. He gave a plain language description of what the policy does. He explained why it exists in a way that tries to make sense for what these laws, but he also provides a clear rebuttal for why this policy is not producing the desired effects and needs to be changed. That is, if a person who can adequately give his side of the case, a justification for the policy that he doesn't, and it's a good tell that he kind of knows what he's talking about and he wants to persuade. So at least I hope that's the case. How would you rather see these businesses be regulated if not going through a certificate of need process?
So, ideally, we would like to see the elimination of con laws nationwide, right? So, That is our
What
number
can you
one
do
goal,
to
right?
demonstrate to me
Short of
that
this
this
goal,
is, in fact, a
which
meaningful
admittedly is a lofty
impingement
one,
upon
we would just like to
competition,
see a
rather than just a
significant
paper tiger, some
reduction in these
bureaucracy
con
that some
restrictions.
companies who can,
So, for example, a great first step would be the elimination
who
of
want to enter
certificate
the
of needs
market
on mental
can
health
do
and
with ease.
psychiatric services,
Yeah,
as
so I
well as
mean,
birthing
this
centers. We've
really
seen
does
around the
happen
country
in
that there
cities where
is a
competitors are
demand
allowed
for
to
both mental
directly
health and
intervene in
psychiatric
the con
services care,
application
as
process.
well
What we
as
see
alternative
predictably
options for
is
folks,
hospital
getting ready
providers
to
with
start a
existing
family and give birth to
facilities who have
children.
a monopoly,
Um,
monopoly to protect,
as to the
and who,
first
in their
category, which are
interest
these mental
not
health
to let
and
competitors
psychiatric
intervene,
services, it seems like
we've
everybody
seen
in the
them
country that
intervene in
we
this
talk to
process
acknowledges that there is
and
this huge mental health
actually
crisis. I mean,
frustrate
we
the
see
growth
it in
and
our streets,
proliferation of
right?
medical services,
And this crisis
facilities, and
became
equipment.
even worse during and after
One
the
example
deadly
I can give, the
COVID
Institute for
19
Justice
pandemic.
litigated a case there.
There is a lack of services and facilities that cater to those most in need of help. That is obvious. The result of the needless con restriction on these psychiatric and mental health services is that they're predictably scarce, which forces patients to seek services at facilities that aren't fully equipped to treat psychiatric conditions. So think like emergency rooms or emergency clinics. This scarcity of those psychiatric and mental health facilities not only raises costs, existing providers can charge high prices since there's no competition, but it also hamstrings services for other patients in need of, say, emergency care at the hospital or at an emergency clinic, right? Um, as for birthing centers, we'd also love to see an elimination of nationwide, and we're encouraging states to eliminate cons for birthing centers. According to some research that we've seen, areas with a lack of maternity care, so like areas that are sometimes referred in the scholarship as maternity care deserts, have a higher risk of poor maternal and infant health outcomes, including death. And, con laws do contribute to this. There isn't studies that necessarily connect them to, they're, they're correlated, right? So when there's obviously a lack of healthcare services in this area, which is for women giving birth, it obviously leads to problems with lack of access and higher costs, which might have a chilling effect on somebody wanting to do something, maybe have a more risky pregnancy in a location like such as their home, or not seek the help that they need. And con laws do contribute to this problem by limiting the proliferation of facilities that offer these services, and which include more than just birthing services. It includes postpartum care as well. Finally, another thing that we are advocating for states to do around the country in lieu of this full-blown con regulation is eliminating a competitor's ability to intervene in the con process. And like I was talking about earlier in the example of the hamburger restaurants and Burger King trying to open, and you have McDonald's across the street saying, no, we don't need a hamburger restaurant. Many states actually permit this practice exactly. They permit existing hospitals and medical facilities to pressure the government into denying a newcomer's application for a new facility or service. And no other business in the country is really regulated like this. It stifles medical innovation, affordability for patients, and patient accessibility to services. So it's a long way of saying that's a few of the ways that we're trying to work with state governments and legislatures to pare back con restrictions if we aren't able to get a full elimination of the regime.
What can you do to demonstrate to me that this is, in fact, a meaningful impingement upon competition, rather than just a paper tiger, some bureaucracy that some companies who can who want to enter the market can do with ease?
Yeah, so I mean, this really does happen in states where competitors are allowed to directly intervene in the con application process. What we see predictably is hospital providers, existing facilities who have a monopoly to protect, and who it's in their interest not to let competitors intervene. We've seen them intervene in this process and actually frustrate the growth and proliferation of medical services, facilities, and equipment. One example I can give you is out of the state of Kentucky. Institute for Justice litigated a case there. This was a few years ago. And what it involved was two individuals who were Nepalese American citizens who were trying to open up a certain healthcare facility catering to folks from the Nepalese American community. And what happened was the state ultimately denied their certificate of need application for opening up this facility. And we sued the cabinet, which is the government agency in the Commonwealth that was responsible for the denial of that application. And although we unfortunately lost that case, made it up all the way to the Sixth Circuit Court of Appeals. They rejected our client's due process and equal protection claims. The court noted that con laws seem to be a failed experiment, and that's a quote, and have outlived their own needs. That is quite the indictment, and it is reflective and acknowledges the fact that this isn't just some paper tiger, as you said, or just paperwork that everybody, or hoops that folks need to jump through in order to do this. This really does happen, and it happens all over in states with both these con restrictions and this provision, this allowing competitors to intervene in this process.
So you don't like con laws. What are you doing about it?
What gave it away? Yeah, so like I said, one of the big things that IJ does is work with in both state houses and courthouses around the country to try to change the status quo. What do we do? So on the legislative side, we work with legislators. We bring them the stories of their constituents, the folks that are most affected by this. It could be patients, it could be entrepreneurs, it could be folks that were waiting 90 minutes for an ambulance to come in the rural part of their state. And we bring their stories, and we bring this research and this data and this evidence to bear, and use that to help explain to folks in these state houses that this is a bad deal. It's a lose-lose, like I said earlier. It's not, con laws are not, as originally intended, reducing costs or increasing access to healthcare. And so, part of that is going through the motions of convincing folks who might believe that on paper this sounds like a good idea, right? That, I guess in theory that if you open up a hospital and allow another hospital to open up across the street, both will take away patients from each other, and at some point both will close, leaving the community with no hospital. Well, we have data, research, decades of which that show that just doesn't really happen. And like I said earlier, we have the examples of two of the biggest states in the country and two of the largest economies in the world, if those states were actually their own countries, Texas and California. We have not seen this issue of rampant hospital closures.
As in Texas and California never had con laws or got rid of their con laws?
They got rid of their con laws. They do not have con laws anymore. So we have seen in those states none of the evidence of the sky is falling type of scenarios that we often hear the proponents make in favor of con laws. So that's on the legislative side. On the legal side, in the courtroom, as I just discussed, we find folks who have been negatively affected by con laws in the con application process, like our clients in Kentucky who just wanted to open up a business that catered to folks from their community and wanted to help folks in their community get access to better medical care. The state of Kentucky said, well, according to this formula we have, there's no need for that. It didn't account for the fact that these folks were trying to open up a business that catered specifically to folks from the patients from the Nepalese American community. So we work with them. We work with other clients around the country to help make sure that their due process and equal protection rights aren't being violated in this certificate of need application process. But of course, that's on both sides, both in the state houses and in the courtrooms. It's been tough going.
I know it's been tough going in the state houses, but there has been some progress recently, hasn't there?
Yes, absolutely. And it's really nice to see both, in the decades since the federal government disavowed con, and in recent years that it seems like folks are waking up to this idea that what I just said was true, right? Khan, as originally intended, as originally envisioned, is just not accomplishing its goals, right? So recently, actually, some of the states that have enacted some positive changes to their con regimes, including Florida, Montana, New Hampshire, South Carolina. After they've enacted these healthcare reforms in the certificate of need programs, there is a substantial inflow of investments in the healthcare community and opportunities for growth, which of course helps lower costs, raises competition, healthy competition between healthcare service providers, and increases accessibility for patients. So, for example, Florida reformed its con laws pretty significantly in 2019. And in the 2 years preceding the reform, the state had approved plans to construct 20 hospitals statewide, right? From 2020
And
to
Florida's a
20,
fast-growing state, and they probably,
yeah,
yeah.
right. So you would think, that especially in the years before the pandemic and then in the years after the pandemic when the population skyrocketed in Florida, a lot of people moving down there, that there would be a significant need for more medical healthcare infrastructure, right? So here's the thing. After it reformed their law, the state reformed their laws from 2020 through 2022, healthcare providers announced plans to build at least 65 new hospitals in the state. That's incredible, right? These people, these businesses would not be building these hospitals if it weren't for a tremendous amount of need in the communities that they're going to come to serve, right? Another example is in Montana. They reformed their con laws in 2021 and have since seen a significant expansion in the construction of both rural and urban healthcare facilities. Montana's a big state, got a lot of rural communities there. This allows businesses to open up, and the elimination or the reduction of con in Montana has allowed businesses that are maybe a little bit more nimble than a hospital or your typical medical facility to come in, to innovate, and to offer those services in places where it has been difficult before for healthcare providers to serve the needs of their community. And last, like I said, New Hampshire was another state where we've seen some progress. They completely eliminated their con laws in 2016. And what we've seen in the wake of that decision is that the state's inpatient mental health care system continues to expand with the construction of new hospitals and expansion of new facilities. And, not only were we seeing these more drastic changes on the state-by-state level, but we're also seeing several states, like including Georgia and Kentucky, take a long, hard look at their con laws and they've recently created legislative task forces to evaluate con reform and see if it's still really working for the state. So we're really encouraged by the fact that our efforts seem to be fruitful, even though it's very difficult to go into these places and make these arguments in light of hospital opposition. We are really we're really feeling good about where this conversation is heading and reform efforts in the future.
You mentioned that hospitals are part of the opposition, and that there have, of course, been a number of battles around the country over this issue in the past few years. What are the arguments that hospitals make?
Well, so as you can imagine, as you said too, our main competition are hospitals, existing facilities, and hospital groups that essentially don't want to see their monopoly on services challenged, right? There's other good reasons. I think they legitimately have this concern too that about these kind of sky is falling type scenarios where, if certificate of need goes away, hospitals are going to close and people are just going to be left with no options, right? We understand that. But like I said earlier, the data doesn't support it, right? We see in Texas and California, again, two big states with big cities, lots of rural communities, a variety of unique and different healthcare needs in the state's populations. We're just not seeing evidence of that happening there, right? So we get it. We get why hospitals in these states who aren't familiar with life without certificate of need, why they're concerned. And if you're a business owner, we get it. You probably don't like competition, right?
Or at
But
least you're
again,
in favor of your ability to prevent competition or bad competitors or whatever.
I'm
Um,
sorry.
I would say, or at least you're in favor of having a say in whether your competitors open up or not.
Yeah, yes, absolutely. So, that's exactly right. And in many states, we see that states give state law on the con regime gives states or competitors um, the veto power over a newcomer's application for building a new facility, expanding an existing service, or buying even medical equipment like MRI machines or CT scanners.
So I'm just trying to think of if I'm a lawmaker and I'm considering a change to this issue, and on one side of the issue, I hear hospitals, many of whom may be important constituents in my district, telling me that these certificate of need laws are good. And on the other, I hear these strange lawyers from this Institute for Justice saying that they're not. It seems like I would have a lot of good reason to defer to the hospitals who are engaging in this practice rather than you. So, what do you bring to the table?
Data, research, conviction, and a megaphone for all of the people that have been negatively affected by this. Truly, that's what we have. We have the data. We would not be in this fight as an institution, as an organization, if the data and the evidence and the research didn't all point towards the repeal of con as better serving the needs of individual patients, their communities that they live in, and the healthcare system as a whole, right? Um, so I get it. I mean, I get that we're from out of town, except when I'm, working in Lansing as a fellow Michigander, right?
Mm-hmm.
I get it. Coming in
Yeah.
from out of town, why should we listen to you? Well, this isn't just our data and research, although IJ has a lot of data and research on this subject that all points towards why repeal or significant reduction of con restrictions should happen. We also point to other institutions, universities, think tanks, organizations that have all come to the same conclusion. Um, and it's interesting, one of our reports that we've written, we highlighted 400 academic quality tests in 128 papers, right? That show that con laws are 500% more likely to lead to a negative or neutral result, such as harming patients, hospitals, communities, and payers, right?
Mm-hmm.
This is the data. This is the research, and it is overwhelmingly showing that this is not good. And beyond the data and the research, like I said, we do find and hear from folks who have been affected by this, right? Who have to wait 90 minutes for an ambulance, who can't open up a business that caters to folks in their community because the state arbitrarily says there isn't a need for that particular service or that particular facility.
Mm-hmm.
So we come to battle with that. And it's often very convincing. I mean, like we've said, we've had some success in many states recently. We just hope to continue working with these folks and showing them our data, our research, and bringing to their attention the plight of those, the real plight, the human costs that these laws impose on people, their communities, etc.
And I think that's really important because while there are hospital associations or medical providing associations in every state that are going to favor incumbent firms and there's favor certificate of need laws, there's not an association of people who have to wait too long for an ambulance. There's not an association of people who would like to start medical businesses, but there are real costs there are real costs and real effects for these laws, and you're doing a job of trying to make this somewhat sometimes abstract idea show that it has real consequences.
Absolutely. That's the goal. And when I first started this job, I heard certificate of need and I'm like, what the heck is that? And I suspect
Yeah.
a lot of people around the country also don't know what it is. And part of our job is just to let folks know what it is and how it affects them. Everybody knows in this country that we have a healthcare crisis on a variety of fronts. Mental health, psychiatric services chief among them, right? This certificate of need regime plays a part in that. when it artificially creates scarcity and fewer options as a result of government fiat, uh, it's not a leap to say that that negatively impacts folks who are otherwise in desperate need of those services, right?
What's it going to take for you to win on this issue?
So, a lot of
It does
work.
require speculation.
Yeah.
Let's.
A lot of work in both state houses and courthouses across the country, right? Like I was saying. So, you know, like I said, educating, sharing our research, our data, and the way that all of, the direction that all of that research and data points to is huge in this effort. And also, frankly, getting connected with folks who've been affected by this. It's not hard to find people who have been affected, who've had to wait a long time for an ambulance, or who've had to drive 100 miles to a hospital when they're in desperate need of medical attention, right? So, getting those folks that megaphone, like I said, and approaching, elected officials with this data and research, and using that synergy and saying, this is something that's got to change today, right? That is, that is how I think we're going to have to approach this in every state. And we're really lucky, like I said, too. There are 12 states in this country that do not have certificate of need laws. I said Texas, California, also Pennsylvania, huge state, big population, right? You have the right, you have the left, you have, red, blue, and purple right there, right? All of them, including the federal government too, have all decided that certificate of need is not for them. And it is easy, or it makes our job easier when we can go into these state houses and say, look, this isn't some hypothetical about what happens. This isn't some research lab question that has produced data that points towards repeal of con being in everybody's best interest. We have these laboratories laboratories of democracy across the country that have decided that it is not for them, and they're doing just fine. And in fact, arguably, I would posit doing much better. There are more options, like in Florida, 40 more hospitals in a 2-year period after con than before, right? We're getting approved to be constructed. That's huge.
It's also huge. I know, one of the biggest factors for whether you're going to get quality services is whether your hospital has a competitor. Like, if there's only one game in town, a lot of them are able to extract higher prices, and if consumers have more options, there's at least some place where you're not just stuck with the highest bill for whatever someone's going to charge you.
Yeah, absolutely. That healthy competition, it's what our economy is based on, right? And it's just we are trying to make this case that there shouldn't be this strange carve out for healthcare. Yes, I understand that there's lots of public money, government, Medicare, Medicaid going into this, and that prices are set for reimbursement rates for hospitals. So there's these elements of government intrusion into this process. I get it, right? It's not exactly like running a hamburger business, right? It's a little bit more complicated than that. But hospitals, facilities, healthcare providers are all subject, because we live in this free market economy, are all subject to these market forces anyways, right? In a variety of different ways. So, yes, absolutely. To your point, getting that gainful, healthy competition can only help lower prices for patients, provide more accessibility, more options, right? Which is great. Everybody likes to choose. You don't want to be stuck with one option. And having those two things leads to, medical innovation and ultimately lower costs for patients, for payers, for state governments, right? So it's a win-win-win.
So let me set out what I think is the Overton window on this issue. It used to be that a lot of states had these certificate of need laws, and there was no chance that that they were ever going to change these laws. Economists did look at this and said, wait a second, we think there might be some problems here, did some empirical assessments, found out that it didn't quite produce the desired effect. Some people like yourselves noticed that, hey, this seems like it's a classic case of concentrated benefits, diffuse cost problem. Let's try and find some of the people who are the victims of this. Let's try and find a legal argument against it. Let's start challenging these things and creating being an advocate against these certificate of need laws. And that kind of swung the Overton window open into the fact that a number of these a number of these laws have been reformed, have been it is politically feasible to get rid of them. It is politically feasible to limit their applicability, and a number of things that you've already talked about. Is that a good case for where things are?
Yeah, absolutely. And I'm optimistic. I'm bullish on con reform, but we do have a long road, ahead of us. But we have the data on our side. We have a lot of folks in the communities who are affected by this on our side. And I'm, really looking forward to seeing the fruit, of our efforts, as well as the efforts of many other organizations and groups across the country, in this fight. So I'm hopeful that we're a few years away from some more really big and positive changes.
Who are your allies on this issue? I mean, it doesn't seem like there's a lot of people who are to be naturally on your side. I mean, I guess some businesses who might want to start hospitals, but...
Yeah, exactly. So competitors are our natural allies, right? People who have been denied the opportunity to start businesses as a result of the certificate of need process. We also, like I said earlier, there are folks in states, we read their stories, we hear about them, we are connected with them, who have been negatively affected by a lack of availability, a lack of choice, or skyrocketing medical expenses when there's only one player in town. It's not hard to find these people. We hear about them every day in the news, and we hear about why the American healthcare system, in many places, needs work and needs an overhaul, right? It's not hard. And then there's also some other friends and allies in the nonprofit and think tank community who we work with and, productively to try to change these laws in different states. So we do have allies, we do have friends. We're going up against some formidable foes, and the hospitals, they, like I said, they have arguments that I think at a surface level seem to really resonate, and I get it. I get why they're fighting this, and hospital groups and healthcare providers. But my goal is to one day help all of us bring everybody together and work with the hospitals, the legislators, the people affected by this, and everybody come to the table and find good solutions for this, even if they're incremental at first. We're okay. We understand that we can't wave a wand and expect cons to just disappear around the country. Sometimes you just need to take a bite out of it here and there, and then we can come back with more data and more information to help our cause. So I know that's maybe another lofty goal that we've discussed, but I would like in an ideal world to work with the folks who disagree with us on this and help come to a good solution about what they're able to do and why reducing or eliminating con restrictions is beneficial for everyone.
Alasdair, good luck in your attempts to shift the Overton window.
Thanks so much. I appreciate it. And thank you so much for having me on today.